You ready? Thank you. I think we're live again today from the City County Health Department in Peoria, Illinois. Welcome. Thank you again to the members of our local media who continue to help us inform the public with up-to-date facts and information to help make this crisis a little bit more digestible. I'm Andrew Rand, Chairman of the Peoria County Board. On behalf of Mayor Artis, Chairman Zimmerman from Tazewell County, and Chairman Krug from Woodford County, I'm happy to tell you that things are a status quo for most of what the organizations I'm engaged with are doing. There is not a lot in the event cycle today. We have an important couple of guests, of course. Monica Hendrickson is here today with some data, and a friend of mine, Dr. Matt Jackson from OSF Ministry, who's the EMS director for several systems in central Illinois and an emergency physician himself for many years. The news from last week's governor's extension of the stay through the end of May, I know, has produced dismay in a lot of corners, and a lot of people continue to ask questions about why not this and why not that. And I would say, as a government official and a community person myself, I think everybody's circumstance is different, and I don't think we can have an answer that massages the pain of any given individual or a business owner or a church leader even who just wants to set things back to the way they were. And while I'm confident we will get our community back, I'm a little less confident that all of the cheating and the grousing and the pain that we're causing people will be something folks will forget for a long time. To that end, I coach everyone who's listening, who's thinking about venturing out unprotected, to please not do so. Remember that your social distancing, physical distancing, is the only way to protect yourself and your family from either contracting or spreading this very, very, very dangerous virus. And I appreciate everyone's efforts to continue to repeat that. It feels like rinse, wash, brush, repeat, rinse, wash, brush, repeat. But that's what it is for a few more weeks. Monica Hendrickson will be up next, and Dr. Jackson will follow her. Monica?
Thank you, Chairman Rand. Good afternoon. We begin today's briefing with our to-date totals for the Tri-County region as of Tuesday, April 28th. The Tri-County region is reporting 118 cases to date. Peoria County is reporting 79, which is 10 new cases from yesterday. Tazewell County is reporting 37, and Woodford County is reporting 12. There are no reported new deaths in the Tri-County region. In terms of the hospital system, OSF St. Francis Medical Center, Unity Point Health Methodist, Proctor, and Pekin are reporting 20 ICU beds in use, 11 for individuals confirmed with COVID-19, and 8 for persons under investigation for COVID-19. In addition, they're reporting 34 non-ICU beds in use for either confirmed or under investigation for COVID-19. For Peoria County specifically, the demographics of the 79 cases include 59% female, 41% male. The age ranges of 30 to 39, 50 to 59, and 60 to 69 have the most cases. And in fact, those ages 30 to 39 are now the age group with the most amount of cases in our county. 56% are white and 39% are black. 48% are recovered and 29% are in home isolation, while another 20% are currently hospitalized. Further information and breakdowns by cases and tested are available at the Peoria City County Health Department website, which is www.pcchd.org. Furthermore, to kind of give an understanding of where we are at with our cases, as well as reporting with some of our community-based testing, 35% of our cases are attached to a congregate living setting, whether it's a long-term care facility or a group home setting. It doesn't necessarily mean residents only, it could mean also staff in that setting. We began testing, Heartland Health Services began testing their drive-through clinics on April 21st. At that time, Peoria County was reporting 44 confirmed cases in our area. Today we sit at 79. Of our 35 new cases in that time span, 45% of them were identified through the community-based testing that Heartland Health Services provide. In fact, 16 of our overall tests have been identified through the Heartland Health Services, recognizing the fact that as we increase community-based testing, we're getting a better understanding of what that level of virus is in our communities. Today, as of 2:50, the two sites for Heartland Health Services include East Bluff, which saw 94 individuals, and Carver, which saw 62, for a total as of 2:50 today at 156 tests. As Chairman Rand mentioned, we are continuing on into our executive order and stay-at-home policies, and a lot of questions that come with stay-at-home is making sure that we want to be compliant with it. We also don't want to have the dangerous side effects of individuals maybe taking that stay-at-home too seriously, as well as wanting to make sure that they are utilizing our services properly. So with that, I'd like to introduce Dr. Matt Jackson from OSF Healthcare to answer some questions. You had a question, sorry.
Sorry, just before Dr. Jackson speaks, I just want some clarification on numbers because Tazewell on their Facebook page has 38.
Sorry, it is 38.
So then 79, 38, and 12, wouldn't that be?
119.
Okay.
Yep. There was new, Woodford County's at 12, Tazewell County's at 38, and then Peoria County's at 79, so it should be 109, I do my math totally off today.
Wouldn't it be 129?
Yes, sorry, 129. I am doing my math off today. It's a Tuesday. We're going to go with that. With that, we'll introduce Dr. Jackson.
Thank you, Monica. Good afternoon. I am Dr. Matt Jackson. I'm the Medical Director for Prehospital and EMS for OSF Healthcare, as well as the Peoria Area EMS system. And we provide the General Medical Authority and supervision for all EMS and dispatch 911 related issues for including Peoria Fire Department and Advanced Medical Transport here in Peoria. I just wanted to start out by giving two parts to this today. The first part I want to give is actually a current state of where we're at with EMS response related to COVID-19. This is something we've been watching very, very carefully. We put into place protocols initially to sort of govern our response levels and to monitor providers and also to make sure we are getting the right resources to the right patient at the right time. I am happy to report that currently response levels are excellent. We do remain at what we consider to be level 2. We've been at that level for a very, very long time now. This is when we have known community spread. And so therefore, right now we remain at level 2 because our response capacity it remains high. We have had and seen very little to no absenteeism amongst EMS providers in the Tri-County area that we oversee, and we have not seen any positive cases reported yet amongst EMS providers. Departments all across our system are actively monitoring all of our providers to ensure that the providers are safe, in addition to also preventing any kind of transmission to patients that they take care of. PPE levels are also being monitored and are being addressed as needed and currently are adequate. So overall, I'm happy to report that the system is working very well. Overall, the general volumes for EMS calls are down. And COVID-19 related calls are also remaining either at constant state per day or also maybe trending slightly downward currently. And this could be due to a number of factors. So therefore, we do have good capacity still in the system, and then we are managing appropriately. The second part of this is I also wanted to address, as Monica sort of brought up, an issue surrounding the stay-at-home phenomenon. And we've seen this nationally. We've also seen this to some degree here locally, where people are tending to have a tendency towards being reluctant to call 911 or to present to their emergency department or to their hospital or healthcare provider until too late. These are both for COVID and non-COVID related symptoms in patients, and this is probably brought upon by a number of issues. Number one, fear of acquiring the virus going into a healthcare facility where COVID-19 is being taken care of, in addition to concerns about violating the stay-at-home orders. There are some people that take these very literal and want to stay at home no matter what the cost. And also there are some that have a fear of potentially being a burden to the healthcare system during a time of crisis. Overall, even though we have sort of stressed that if you have an emergency, we need you to come to the emergency department, some people tend to think, well, I can put off these symptoms and I can hold myself at home. The unintended consequence to this is really creating a delay in treatment, which could lead to worsening outcomes, leading to either chronic disability, functional limitations, or even death. And so while some of the elements of concern about these issues can really be a healthy thing, we want to assure people and reassure people that the healthcare community in this community and elsewhere even, and EMS providers are really taking appropriate precautions to keep non-COVID concerns and non-COVID related complaints away from COVID related populations that we are actively taking care of in the community. There are protocols in place to make sure that the places where patients are being taken care of are being sanitized and cleaned for the protection of the patients, and we're doing everything in our power to prevent anything like that from transmitting into a patient population. So another thing as well is, as far as being a burden to the healthcare system, overall emergency department volumes are down across the board in all healthcare settings. As our EMS calls, like I mentioned before, we can provide care when needed. We stand ready to take care of anyone who has an emergency. And our providers really do take abundant precautions with every patient. So please do not ignore serious symptoms. We have seen this in relationship to heart attack, to stroke, and even surgical emergencies. And some of the things that we do not want people to ignore, especially with heart attack symptoms, classic symptoms would include chest pain, especially worsened by activity, or fatigue worsened by activity, accompanied with shortness of breath, sweating, nausea, pain that starts in the chest and then radiates into the arm or jaw or back. These things could be a serious sign of something worse going on that needs a prompt medical attention. In addition, signs of stroke, balance problem, new vision problems, facial asymmetry, speech problems. These sorts of things are things that are very paramount for people to keep monitored on, and obviously weakness. And then there's obviously a time element to this too. These are timely concerns that need prompt medical attention. So these, along with any other emergency, if you feel like you have an emergency, you feel like you need attention, then by all means, we are here to help. And the 911 system is here to help, and we do have capacity built into that, and we do have ample capacity in our emergency department to take care of you. The last thing we want to have happen is anyone stay at home for too long and suffer an adverse outcome. And with that, I'll answer any questions.
Dr. Jackson, you're the second speaker to kind of bring this up in recent days of people, who suffer maybe a non-COVID related emergency being reluctant to call 911. How prevalent is this problem in Central Illinois right now? Have you noticed it happening a lot more?
Some of this is anecdotal. We have seen the overall acuity level of some of our patients presenting to our emergency department overall being higher. So we're seeing an increased number of sicker patients, even though the overall numbers are down. The overall sicker patients are coming in, and these are not all COVID-related patients. These are heart attacks and strokes and things of that nature. And so the thought is, what is the common element here that is causing that, and that potentially is a delay in treatment related to fears of coming to the emergency department or due to calling 911.
What kind of questions are dispatchers asking those who call that would prompt a protocol 36?
Currently, what they are asking, as far as the call, like when the 911 caller takes the 911 call, so the questions that are being asked by the 911 dispatcher include fever and respiratory symptoms such as cough, runny nose, sore throat, and then body ills, or body chills and or aches.
I know other speakers and you yourself have spoken about this, but just reminding the public to be completely honest with dispatchers, because despite even having COVID systems, someone will come and help you, but there's different protocols in place.
Correct, absolutely. And we do have framework in place, as you mentioned before, that when somebody does have an emergency, we do want to know what your symptoms are, not only so that we can protect our EMS crews, but that we can offer the right amount of care for the patient as well, and that we can be prepared for that.
So if someone is going if they feel like they need to go to the ER, is this something where they should call ahead or call their provider, so kind of the hospital has a heads up, okay, we have this coming in that's probably not COVID related, or would they arrive to the ER as typically would before all of this?
So the question is essentially, if somebody feels that they have an emergency, should they call their physician or healthcare provider first prior to calling 911? I would say if somebody has a healthcare concern that they feel is an emergency, they should call 911. They should skip that other piece to it.
You mentioned that numbers are low in this area in terms of EMS providers becoming ill, but do you have an idea of how many have contracted COVID-19?
Across, as far as numbers of providers that have contracted in the state or locally or nationally? Locally, I have none currently.
And you also said that the calls are down for EMS. Do you know around how many calls a day you guys are getting for COVID?
As far as the number of calls that we get per day, 911 calls, it's hit or miss, and some days are a little higher than others. I couldn't speak to the exact numbers per day, but I know that the trend has been down.
Could I just get some quick clarification on how wide an area Peoria area EMS covers the Peoria, Council, Woodford, as opposed to some of the other outlying counties?
Sure. So as far the question is how big is Peoria area EMS? What areas do we cover? We cover approximately seven county region, including the majority of Woodford, Tazewell, and Peoria County. We also cover Marshall County, Fulton County, and little pieces of Stark and some of the other outlying counties as well. So we oversee 75 agencies, including multiple dispatch centers.
Correct me if I'm wrong, but there is a policy that's just been put in place that if you are to go to the emergency department, you do have to have a mask on starting May 1st, correct?
That is correct.
Could you restate that?
Yes. So the concern was if you do go to the emergency department, if you do go into a healthcare setting, you're supposed to wear a mask. Is that right? Or some sort of face covering. And yes, May 1st, that does apply.
Thank you, Dr. Jackson.
Okay, thank you.
Are there any other follow-up questions?
Could you repeat the number of hospital beds being used again, please?
Definitely. So the question is about the hospital beds currently being utilized. So reporting for the 4 hospital systems of OSF St. Francis Medical Center, Union Point Health, Methodist, Pekin, and Proctor, there are currently 20 ICU beds in use, 11 for individuals confirmed with COVID-19, and 9 for persons under investigation for COVID-19. In addition, there are 34 non-ICU beds in use for either confirmed or under investigation for COVID-19.
Monica, Dr. Ezike has said that around 69% of people with COVID-19 usually recover, I believe she said within 28 days. Are we seeing similar numbers for Peoria County, or kind of what's the data that you're seeing here?
So Dr. Ezike's comment today was, I think, showing that overall people are recovering. In fact, 74% of individuals from the time they tested positive 4 weeks out will have recovered. 61% between that 2 to 4 week period, and 49% actually less than 2 weeks from when they were tested. And so I think it's really highlighting the fact that people are recovering from that. What we're seeing locally here is that that number of recovered continues to grow. We do follow up with our cases. We do initial contact with them, seeing how they do symptomatically, and then, especially if they're still having a fever, we let them recover in peace and call them back about 3 days later, because really the recovery is, again, by symptoms, as well as some individuals, depending on their need, may require testing to get cleared. But for the most part, we're basing this on symptom as recovering. And so we've seen a good increase overall about individuals just recovering and able to really recover at home. And I think that's the important part as part of this discussion.
Monica, you mentioned that about a third of the positive cases known stem from a congregate living facility. Do we know if any of those include any local county jails?
Right now, all of our congregate living settings are either long-term care facilities or some type of group home setting. They do not include any of our jails in our Tri-County region.
Were the 10 new cases that you mentioned earlier, were those diagnosed through the Heartland Health Services clinics?
So the 10 new cases specifically for Peoria County that we reported new overnight, 5 were from Heartland Health Services and 5 were from your hospital systems. It's okay if you have a question.
Oh, yes, sorry, apologize. Monica, if you could, I think the general public gets a little, I think, frustrated and confused when they see the confirmed case numbers and they say, well, so many of them have recovered, why don't we just say like the number of current cases? If you could explain kind of IDPH's reasoning behind that.
So the question is, we report confirmed cases regardless of where they are in terms of their status. So if they're recovered, we don't necessarily take them off of the confirmed case count. And the reason why we are using this measure is partly because we still don't necessarily know if someone that has recovered from COVID-19 is developed immunity to it or is ability to transmit it. So really our response. And you'll see that Peoria City County Health Department and Tazewell County Health Department provide stats. So when you're looking at the status, recovered, hospitalized, home isolation, and death, the sum of all those values should be our to-date values. And again, the reason why is because we're still learning more about this virus.
And now that testing's been expanded quite a bit, I was just wondering if you had an updated kind of ratio on where the actual cases are coming from, people that are being tested. Is it still mostly Peoria County? Are we seeing a lot from all across the region?
So in terms of our open testing that we have now through Heartland Health Services, majority of individuals are still coming through from the Peoria area, but that does include some of the Pekin region as well, Creve Coeur we're seeing in East Peoria. But we also notice that some of our communities, especially in central Illinois, that don't necessarily are attached to a federally qualified health center are really traveling to get tested, because community-based testing is going to be a great indicator of understanding in a community just that type of prevalence of the virus in general.
I'm just curious, can you tell how far some people are traveling to get testing here?
So I don't have all the negatives. They only those that reside in my jurisdiction I know of. But having walked the line with Sharon Adams from Heartland Health Services, we've heard people coming from Kewanee and as far as LaSalle as well. So really, people are coming in from a variety of places to get tested here.
And I've heard anecdotally also that the testing guidelines at the Bloomington site, since that's a federally funded site, are a little bit stricter than here. So I've heard there's a significant amount of people from Bloomington and McLean County actually coming over here for testing now. Is that accurate?
So the question is, with the federal site being in Bloomington or McLean County, having stricter guidelines, are we seeing a kind of a population shift over here to Peoria? We haven't been seeing that. And actually, I don't necessarily know how accurate that is, partly because now it has moved over to some state-supported aspects, so they should have actually similar testing requirements too.
Monica, yesterday you mentioned that one of your concerns about opening the community back up was the surrounding areas. That we're handling things pretty well here. Is there less testing going on in surrounding communities? Is that what you were talking about, or what are some of your concerns about the surrounding communities?
So the question is, we're talking about reopening and how comfortable different entities feel about the progress towards it. If we lived in a vacuum of just Peoria, knowing our community partners, the ability to have that capacity for testing, the educational outreach that's been done, I feel confident in terms of Peoria County and the city of Peoria, and even moving into some of our neighboring communities. What I think the difficulty is that one of the great measures that we've been able to accomplish as a state is getting over 10,000 tests daily done. The question is, what is that distribution of testing? If you think about 2/3 of the population residing in the Chicago area and the Colorado County, the testing does not match that distribution. So that would mean approximately 3,000 tests are being done in the other part of the state. And that's a small amount of tests for a large span of area and population, and recognizing the accessibility to it. We are very fortunate, and I cannot say enough, having our representatives, Jahan Gordon Booth, Ryan Spain, as well as Senator Kaler and Senator Weaver, and then our local leadership, Chairman Rand and Mayor Artis, advocating for testing, because it is the #1 tool that we're going to have. If you look back a few weeks ago, our present positivity, so number of positive cases to total testing, we were, upper 17%, 18%. Today, I think we're at 5%, and that's largely in part because of increased testing capacity.
Monica, the 1st of May is coming up pretty quickly. What would your message be to some people who are just going to opt out and wearing a mask out in certain places where 6 feet distance can't be maintained?
So the question is, once May 1st kind of comes through here, individuals opting out for not wearing a mask, even though they can't socially distance. And I think it's going to be the same message that we've said this whole time, which is this is about keeping the entire community safe. I understand a lot of individuals have they've discussed it with me, that, hey, this is my choice. I know how to keep myself safe. And I understand that philosophy. At the same time, the mission of this health department is really up there on the wall. It's to make sure that we create a healthy and thriving community, not for certain groups of people or some people, but for all people. And so our mission is public safety and public health. And so when you're out in public, recognizing the fact that your minimum risk that you might have, and you know yourself best, does not necessarily get reflected on the people around you. This is a virus. No one has immunity to it. It is novel. And while you might have a mild case, I know Dr. Jackson and I have stated before, 80% of people will have a mild case. They'll be able to recover at home with fever-reducing medication, maybe talk to a lot of the telehealth services that we have here available, and then be recovered within that 2-week period. But again, you have to recognize that there are individuals with various comorbidities or other illnesses, diabetes, heart disease, respiratory illness, asthma, COPD. And so it's really recognizing the fact that how your actions can impact others. And so I would just strongly encourage that wearing a face mask, especially while we've done so well this past month, and we're now transitioning and looking at ways to keep relaxing regulations, what I would hate for us to do, and I think the chairman has said, and so is the mayor, is don't erase all the good work we've done. Our numbers are small because we've done good work. We're not through the clear, and if we can continue working through this and do this as what it is, which is not a restriction but a medical intervention that our community is doing, then we're able to get back to normalcy sooner. And again, we're all going to cross that finish line together, not one group versus another.
Is there anything new to report on testing in nursing homes? I know you talked last week that the hospital systems were trying to do something to ramp that up, and we also talked about the governor's task force coming down here and testing. Have you heard anything new on that?
So we actually, the question is about long-term care facilities and testing. We had a call with our long-term care facilities. On Monday, we had one with our healthcare providers, and what our plan here is locally is to assess the testing needs of our long-term care facilities, recommending the utilization of our community-based clinics, which is open 7 days a week for staff, but understanding what their client needs are, how many may have restrictions in terms of travel, and then be able to use Heartland Health Services, Unity Point Health, OSF St. Francis Medical Center, as well as the University of Illinois College of Medicine in Peoria, to train staff to properly test and then provide them with test kits. And so that is our plan. Like I said, Monday was the first discussion. Today, our long-term care facilities started giving us a lot of data and requests, and we're hopefully can put this into play by next week.
I spoke to a woman who, she has a sister in a long-term care facility, and she wanted to get her tested, and since then, the testing sites have come up, but she's afraid to go and get her sister. She's 70-something. She has a husband who's 90. She doesn't want to get exposed to this. So, that's a situation where having testing in the home is kind of important.
And I think that's a great point. So the question or the comment being that individuals that, nursing homes or long-term care facilities have done a fantastic job working through this process. And imagine the fact that they are having to, not only with their staff, but their residents, maintain restrictions that I don't think general public recognize, that they are taking temperatures and vitals routinely through the day. They are disinfecting and doing universal masking. The amount of precautions our long-term care facilities are doing is impressive. And cases still show up. And it is, I will say, not a fault of the long-term care facilities. It's just the fact that this is how this virus operates. And so recognizing that, we want to make sure we can bring testing to them so that, again, limiting the fact of the exposure outwards and, again, building on the good work that our long-term care facilities have been doing. Okay. Well, thank you, guys. We will see you tomorrow.